We're at 7:44. It is 61 degrees this morning at KNEB. Our News Extra program is next and is brought to you today by Jolliffe Funeral Home. Here's Kevin Mooney.
Thank you, Dennis, and good morning, everyone. Very pleased today to have Sue Maxcy here and Mary Skiles. And Sue is going to be discussing here in a little while a class in regards to managing diabetes. Mary Skiles is here, a registered dietitian at the diabetes clinic over at Regional West Medical Center. So we're going to kind of start with her and have her talk just briefly about the diabetes clinic, which has been around for a little while anyway, 10 years. And you're over there, and you're probably seeing even more and more and more patients all the time. Am I right?
Right. Kevin, we are pleased to be able to offer this educational service through Regional West Physicians Clinic. The Diabetes Care Center, as you said, has been around about 10 years. And when we first started, we weren't seeing quite as many people, and as time has gone on, our physicians use us to educate their patients, and the overall national push to educate people about diabetes so we can have better self-management with diabetes has increased, so therefore we are seeing a lot of people.
Yeah, and there is a whole lot more about diabetes in the media and everywhere else, and partly because there's just been such a rise in people that have the disease now. Am I right?
Absolutely. In the United States, there's what the statistics are now 28 million that have diabetes, and even more that don't know they have it. We feel very fortunate that we are able to provide education to them. We have a significant staff that's very qualified to help teach people about diabetes, and it's certainly a compliment to our physicians because our physicians can't do that in the office. They're managing their diabetes medically, and they need that extra education provided to their patients, and we're really glad that we have the opportunity to do that because statistics show, and I can't even quote the percentage, but people that get education do so much better controlling their diabetes than those that do not.
Yeah, exactly, and that education includes blood sugar counts and
absolutely,
and
we
taking
teach
insulin and all that kind of stuff.
Absolutely, we teach them about the disease itself, how to manage it through diet, exercise, medication, how to monitor their blood sugars, the importance of controlling their diabetes for life, short-term issues, long-term issues that may arise from poor control, all of those things so that they know why they're managing their diabetes, because these patients are doing the majority of their self-management, not their physician, not us, but the patient. So they need to understand why they're doing what they're doing.
All right. How do people discover that they have diabetes or think maybe I've got a problem here and maybe I have this disease? I look at my lifestyle and maybe I'm having some issues and maybe that's what it is. How do they discover it, and then how do they get referred to you?
Well, a lot of times it's discovered accidentally. They went to a health fair, had some blood work drawn, or maybe they just weren't feeling well and they went to see their physician. Most of us don't go to the physician unless we have a reason to go.
That's exactly
and
right.
That's what drives them there. But often it's just a casual blood sugar at a health fair or somewhere else. And so then they go in to see their physician. If they're being seen regular by the physician, it may come up through blood work that they have done annually. They are referred through their primary care physician, whether it be internal med, family practice, or outside of the area. And then most insurances, particularly Medicare and Medicaid, will pay for this education, and some private insurances now are coming along because Medicare and Medicaid have come that far with educating people because they are seeing the documented success of education in helping control blood sugars.
Okay, so if folks want to talk to you about it, they get referred from their physician.
Exactly.
And then they go to the clinic.
Right,
And
and if they don't want to go that way, we can certainly help them by, if they contact us and like to schedule an appointment. If they've seen their physician, we will contact their physician, but generally there has to be some communication that way in getting them connected with us. But it's not a problem, it's easy to do, and we're certainly glad to see them. We're lucky because on staff we have some very experienced educators. Sue Maxcy has been a nurse for how many years? for forever, and she is wonderful. She is so good with our patients, and she teaches them a lot about diabetes. We also have a new staff member. Her name is Sherry Smart. She's an RN also, and she complements the work that Sue does. Sue is a certified diabetes educator, and Sherry is working on that process. And then Marcia Bauer and myself are both registered dietitians. We both have been at a Regional West Physicians Clinic for 17 years, and both of us have been practicing for over 30 years and have been in diabetes for forever. So we feel like we can offer a lot to our patients.
All right, very good. So people should take advantage of that, and I'm sure they do.
I think they enjoy it. I mean, it's a hard disease to have,
Yeah.
but it's a lot easier to manage when you know how to do it.
Yeah.
And we feel like we offer a great deal of security and hope and education, and we just make it easier. And we're proud of that. We really are.
All right. We'll take a break, and we'll have Sue come in here, talk about this program that's coming up here in September right after this.
Is that right?
Good.
Did I miss anything?
We might just, you could maybe describe when you're talking with this guy, about this guy, the difference between type 1 and type 2 and the seriousness of it, okay? Because since he's a type 1 gentleman.
Could you have Sue pull up just a little bit? Give him
Oh yeah,
frame?
I better have you pull up here Sue a little bit, so you can kind of get in the video frame here.
So referrals,
There you go.
kind of a touchy issue. Because if they're not seeing their physician.
All right, we are back on News Extra, and once again we have Mary Skiles and Sue Maxcy, who work over at the Regional West Physicians Clinic, Clinic Diabetes Center, and we've kind of been discussing a little bit about diabetes, and now Sue is going to tell us you have a special program that's coming up in September, in which you're going to have a very special guest who has diabetes. He's going to talk about managing the disease, right?
That's right, Kevin. This is actually one of our regular class sessions. We have educational classes the second and fourth Tuesday of every month at the South Plaza, 5:30 to 6:30, and we just welcome anybody to come to those classes. You also might call it an education/support group, and we just have people that come and they really get a lot of benefit out of it and a lot of support, and they know everybody sitting in that room understands what they're going through. The gentleman that we have coming to talk on September 11th is a type 1 diabetic. His name is Gary Montouri. Probably not saying that quite right. He is from California, and he is being sponsored by a drug company that makes several different kinds of insulin. It's Sanofi Advantis Pharmaceuticals. I have met this gentleman. He is really a nice gentleman. He is a type 1 diabetic, and he is a little different than most type 1 diabetics because most type 1s are diagnosed at a very early age, anywhere from a couple of months of age up to into the early 20s. And he was diagnosed a little bit later in life. Folks who have type 1 diabetes is an autoimmune disease, and they are on insulin. They're on insulin for their daily survival. And I'm really excited about him to come because I have heard him talk, and he's very energetic and he's very passionate about people taking care of their disease. Just a little bit about type 2 diabetes, which is the more prevalent diabetes that we see. That diabetes, there is a genetic component to it. It is seen more often in Hispanics, Native Americans, Black Americans, but certainly lots, that's not all inclusive. And it is more of a lifestyle disease. And it's a disease that has grown rapidly in the last 15 to 20 years. And primarily that's because of our lifestyle. And Gary will talk about lifestyle. And he will talk about how he has controlled his diabetes for many years. And and that has helped him prevent complications of diabetes. And I'm really looking forward to it. Once again, it's September 11th, 5:30 to 6:30 at Regional West Physicians Clinic, South Plaza. It's the large classroom as you come into the office, room 1202. You can't miss it. And once again, we'd like anyone who's interested to come. You don't have to have diabetes. Maybe your mom has diabetes, your husband that maybe won't come. Come and listen. If you have a type 1 diabetic or you are a type 1 diabetic, Gary is going to be wonderful in giving you some very useful information.
All right, very good. Once again, Tuesday, September 11th, 5:30, Regional West Physician Clinic in the large classroom 1202, South Plaza. That's where you need to go. Thank you very much for coming in. Thank you, Mary. Appreciate it.
Bet.
Thank you.
All right.